I've got some statistics here that I just want to read those, and then I need to talk to you from my heart. Some of the things that the Affordable Care Act has done for the African American community: 410,000 young adults, and that translates to almost 10,000 in Nevada. More than 28,000 in Nevada. Seniors now have access to private health care. 1.5 million Nevadans no longer have to worry about getting health care or not being denied health care because they don't have the money for the for the copay. 10.4 million African Americans no longer have lifetime limits, and 30,300 small businesses now can potentially benefit from the tax credits that are offered under the Affordable Care Act. Now, let me say this. I am a woman. I am a pastor. I am a retired military officer. I know firsthand what it means to have health care. A few years ago, in one of the churches that I pastored, I talked frequently to one of our ushers, and every Sunday she would say, "Oh, Pastor," she said, "I'm doing okay, but I can't get rid of this pain in my stomach." And I kept saying, "Well, have you gone to the doctor?" She said, "Well, I can't go because I don't have health care insurance." And so I said, "Well, go to the emergency room. You know, we got to find out what's going on." And she continued to put it off because she was embarrassed to go to the emergency room. 2 months later, I said, "Go to the doctor and the church will pay for it. You just need to get there and find out what's going on." And when she went to the doctor, she found out that she had stage 3 stomach cancer. Less than 4 months later, she was gone. What the Affordable Care Act does is it affords people who formerly could not afford health insurance, it affords them an opportunity now to have it. And so we know what the numbers, we know what the statistics, we know what the demographics say, but we've got to understand this from a personal standpoint. We've got to understand this in terms of how it affects people. There are some people, some seniors that I have pastored who had to stretch their medication out because they could not afford it. Not only seniors, but we have some families who had to stretch out the medication of their children because they could not afford it. Think about the lives that we're saving. And so as people begin to try to dismantle this, and as people continue to try to castigate this, I would say to them, unless you're willing to walk in the shoes of the people who had to deal with health care issues before the Affordable Health Care Act, I would say to them, come walk a mile in their shoes. Understand what it feels like to have something going on in your body and you don't know what it is and you can't afford to get there. Understand what it feels like as a senior to try to sit down and look at 30 days worth of supply, prescription supply, and you've got to decide, am I going to take this every other day or am I going to take it every day? Understand what it feels like as a parent to look at your child who is suffering and you can't do anything about it because you do not have health care. So until they walk a mile, 2 miles, or even a block in the shoes of those who had to deal with health care issues before the Affordable Health Care Act, I would say you're talking loud and saying nothing. That's right.